Welcome to today's video on the early warning signs of heart failure. Let me ask you something. What if your body is already trying to warn you about heart trouble right now? Signals that could literally save your life. Signals that, unfortunately, most people ignore. Here's the reality. Over 6 million Americans are living with heart failure today. The scary part? Most don't realize what's happening until the condition has already advanced. And research shows a huge reason for this is because the earliest signs get brushed off as normal aging, stress, or just being out of shape. But here's the truth. Your heart often starts sending distress signals months before things get serious. That's exactly what we're uncovering today. 13 subtle but powerful early warning signs of heart failure that are easy to miss. Some of these may surprise you, like why something as simple as bending over to tie your shoes can suddenly leave you breathless, or why you might need more pillows at night just to sleep comfortably. Stick with me until the end, because knowing these signs could genuinely make the difference between catching heart failure early or missing the window to act. And a quick reminder before we dive in, this video is for educational purposes only. It's not a substitute for professional medical advice. All the research is backed up, and I've linked references in the description if you want to explore further. With that said, let's start with sign number 1. 1. Shortness of breath. During normal activity. The first sign is shortness of breath on exertion, and this is probably the one most people ignore. We're not talking about feeling winded after running sprints or doing a tough workout. This is about becoming breathless after everyday tasks that used to feel easy. Climbing one flight of stairs, walking to the mailbox, carrying groceries. According to the American Heart Association, this kind of breathlessness, called exertional dyspnea, is one of the earliest and most common signs of heart failure. Here's what's happening inside your body. When your heart isn't pumping strongly enough, it can't keep up with your muscles' demand for oxygen during movement. Your lungs step in to compensate, and your breathing becomes strained. The difference between normal tiredness and a heart issue comes down to progression. If you notice that the same activities you used to breeze through now leave you short of breath, or if you need to stop and rest more often, that's your body sending a clear message. Studies even show this symptom often shows up months before other warning signs, so don't chalk it up to getting older, or just being out of shape. 2. Needing extra pillows to sleep, orthopnea. The second sign is something called orthopnea. This is when you notice that you need more pillows to breathe comfortably while lying down. Here's why it happens. When you're lying flat, gravity no longer helps your heart pump blood back up from your lower body. If your heart is weakened, this can cause blood to back up in the pulmonary veins, the vessels that carry blood from your lungs to your heart. That backup leads to fluid leaking into the lungs, making it harder to breathe when flat. Research shows about 80% of heart failure patients experience orthopnea. And here's what makes it tricky. It creeps up slowly. At first, you might just add one extra pillow, then another. Eventually, some people find they can only sleep sitting up in a recliner. Most people brush it off thinking it's just a comfort preference or maybe acid reflux. But if you've gone from sleeping flat to needing multiple pillows or sleeping upright because breathing feels easier, that's a sign worth paying attention to. 3. Waking up. Gasping for air, paroxysmal nocturnal dyspnea. Now imagine this. You're fast asleep, and suddenly, you wake up gasping for air. Your heart is racing, you feel panicked, and you have to sit or even stand to catch your breath. This frightening experience is called paroxysmal nocturnal dyspnea, and it's another strong red flag for heart failure. Here's the science. Throughout the day, fluid tends to build up in your legs. When you lie down for hours at night, that fluid shifts back into your bloodstream, and your already struggling heart can't handle the extra load. The result? Fluid builds up in your lungs, jolting you awake in a state of breathlessness. Clinical studies show this usually happens 2 to 4 hours after falling asleep. Patients often describe rushing to an open window, desperate for air. The danger is that people often confuse these episodes with nightmares, anxiety, or even sleep apnea. But if you're repeatedly waking up gasping for air, especially if it's happening more often, it's time for a medical evaluation. 4. Persistent fatigue and reduced stamina. The fourth sign is one most people dismiss: fatigue that just won't go away. This isn't the "I stayed up too late" kind of tiredness that goes away after rest. It's a constant, heavy fatigue that lingers even after a good night's sleep. It makes everyday tasks, like grocery shopping, climbing stairs, or even showering, feel draining. Here's why. When your heart struggles to pump effectively, your body diverts blood to your most vital organs, like your brain and heart, while reducing flow to less critical areas, including your muscles. Less oxygen to your muscles means you tire out much faster. What's more, your exercise tolerance drops. Things you once enjoyed might now feel impossible. Recovery takes longer. A short walk may leave you needing a long break. The progression is gradual, which is why many people adapt without realizing it. They start avoiding activities, blaming age or lifestyle. But this steady decline in stamina isn't normal aging. It's your heart quietly struggling. 5. Swelling in ankles, feet, or legs, peripheral edema. One of the more visible early warning signs is swelling in the lower body, medically called peripheral edema. This isn't the mild puffiness you get from sitting too long. This is persistent swelling that worsens as the day goes on, most noticeable by evening. Here's what's happening. When your heart can't pump blood effectively, circulation slows and blood starts pooling in your lower extremities. On top of that, your kidneys, getting less blood flow, start retaining sodium and water. The combination forces fluid out into surrounding tissues, creating swelling. Research shows about 70% of patients have noticeable swelling by the time they're diagnosed with heart failure. It usually starts in the feet and ankles, then progresses up to the calves and thighs. You might see sock lines digging deeper into your skin, shoes that feel tighter by evening, or even rings that suddenly don't fit. The swelling from heart failure is usually symmetrical, affecting both legs equally. If you press into the swollen area and an indentation lingers for a few seconds, that's a clear red flag. 6. Rapid weight gain from fluid retention. Sign number 6 is a measurable one: rapid weight gain caused by fluid buildup. This isn't about slow weight gain from extra calories. This is about gaining several pounds within just a few days. The American Heart Association says if you gain 2 to 3 pounds in a single day, or 5 or more pounds in a week, you should contact your healthcare provider immediately. Here's why. When your heart weakens, it sets off hormonal signals that cause your kidneys to hold onto salt and water. Each pound you gain represents extra fluid that your body is retaining, sometimes before any visible swelling appears. That's why doctors often advise people with heart failure to weigh themselves daily. The scale can reveal fluid buildup before you even feel short of breath or notice swollen ankles. The key difference is consistency. Normal fluctuations go up and down, but with heart failure, the weight keeps creeping upward, often with a bloated or heavy feeling that doesn't match your eating habits. 7. Frequent nighttime urination, nocturia. The 7th sign is something many people dismiss as just getting older: frequent trips to the bathroom at night. Here's the science. During the day, fluid builds up in your lower legs while you're upright. If your heart is weak, it can't pump that fluid efficiently. But when you lie down at night, gravity shifts that fluid back into circulation. And your kidneys suddenly have to filter it out, leading to more urine production. Research shows nocturia can actually be one of the earliest signs of heart failure, even before obvious symptoms like swelling or shortness of breath. If you notice yourself waking up 3-4 times per night, with each trip producing larger amounts of urine than usual, that's not just normal aging. It's a possible early red flag. 8. Nighttime cough or wheezing. When lying down. Next up is a symptom that often sneaks under the radar. A nagging cough that shows up mainly at night or when you're lying flat. This isn't the productive cough of a cold or the tickle of seasonal allergies. It's usually described as a dry, persistent cough that disrupts sleep and often eases when you sit upright. Here's why it happens. When you lie flat, the fluid that builds up during the day shifts around, sometimes pooling in your lungs. Even a small amount of this fluid can irritate your airways, causing your body to respond with coughing. Doctors sometimes call this a cardiac cough. In some cases, it might bring up frothy white or even pink-tinged mucus, another sign that fluid is leaking into the lungs. It's easy to mistake this for allergies, asthma, or post-nasal drip, but the timing is key. If your cough shows up mainly at night or worsens when lying down, it's worth looking into. 9. Heart palpitations or irregular pulse. The 9th sign is one that feels especially unsettling: heart palpitations. This is when you suddenly notice your heart fluttering, pounding, racing, or skipping beats. Some people describe it as feeling like their heart is doing flips in their chest. When the heart muscle weakens, it may develop irregular rhythms in its struggle to keep blood moving. Sometimes this shows up as atrial fibrillation, a common heart rhythm disorder that not only worsens heart failure, but can also be triggered by it. It's a two-way street. The arrhythmia can cause heart failure, and heart failure can create arrhythmias. Research from major cardiology centers shows these irregular rhythms can rapidly make the condition worse if left unchecked. Palpitations are often more noticeable when you're resting or lying down, and they can be accompanied by anxiety or a feeling of unease. While palpitations can be harmless on their own, when they happen alongside other symptoms we've covered, they become a red flag that shouldn't be ignored. 10. Dizziness or near-fainting episodes. The 10th sign is dizziness, lightheadedness, or even fainting spells. These happen because your weakened heart can't always pump enough blood to keep a steady flow to your brain, especially during position changes or physical exertion. Normally, when you stand up quickly or start moving, your body adjusts to keep your blood pressure stable. But if your heart can't keep up, the result is a sudden drop in circulation, leaving you dizzy or on the verge of passing out. Clinical studies show about 1 in 5 heart failure patients experience fainting episodes, sometimes well before other symptoms appear. The danger is that these episodes are often dismissed as dehydration, side effects from medication, or inner ear problems, and while those causes are possible, the pattern matters. If you're having recurring dizzy spells, particularly combined with fatigue, swelling, or shortness of breath, it could point to an underlying cardiac issue. 11. Abdominal bloating, poor appetite, or feeling full. Quickly. Heart failure doesn't just affect your lungs and circulation, it also impacts your digestive system. That's why another early sign is persistent bloating, poor appetite, or feeling full after eating very little. Here's what's going on. When your heart struggles, blood flow to your digestive organs slows. On top of that, fluid may start to collect in your abdomen, and your liver can become congested with blood that isn't circulating efficiently. This creates a cycle of digestive problems. Patients often report feeling nauseated, losing their appetite, or noticing their belly feels swollen and tight even when they haven't eaten much. Some even describe pain or pressure in the upper right side of the abdomen, where the liver is located. What makes this tricky is that these symptoms are easy to misinterpret as stomach issues, diet problems, or just eating too much. But if bloating and early fullness persist despite lifestyle changes, it could be your heart, not your stomach, that's struggling. 12. Shortness of breath. When bending forward, bendopnea. Sign number 12 is one you might not have heard of before, bendopnea. This is shortness of breath that shows up within 30 seconds of bending forward, like when you're tying your shoes, picking something up from the floor, or leaning over the sink. This sign was only formally recognized in medical research in 2014, but it's proven to be highly specific to heart failure. Here's why. When you bend forward, your abdominal pressure increases, pushing against the diaphragm and chest cavity. For a healthy heart, that's not a big deal. But if your heart is already under stress from high-filling pressures, that extra squeeze is enough to tip you into breathlessness almost immediately. Studies show bendopnea occurs in about 30% of heart failure patients and is strongly linked to more advanced disease. The important thing here is specificity. Healthy people almost never experience this symptom. If bending over reliably leaves you breathless, that's a sign worth bringing to your doctor's attention. 13. Cold hands, feet, or narrow pulse pressure. The final early warning sign involves circulation, cold hands and feet, or what's called narrow pulse pressure. When heart failure develops, your body goes into survival mode. It prioritizes blood flow to vital organs like the brain and heart, cutting back on circulation to the extremities. The result? Your hands and feet may feel persistently cold, even in warm weather. Some people even notice a bluish tinge in their fingers, toes, or lips. Another clue is narrow pulse pressure. Normally, there should be about a 40 mm gap between the top, systolic, and bottom, diastolic numbers in your blood pressure reading. When that gap shrinks significantly, it suggests your heart isn't pumping out enough blood with each beat. Medical research shows these circulatory changes often creep in gradually, but they can be powerful early markers of reduced heart function. What you should do, if you recognize yourself in any of these signs, here's the most important takeaway. Don't panic, but don't ignore them either. Too often, people brush these off thinking, I'm just aging. I'm just tired from stress. It's just allergies. But when these symptoms persist, or worse, start stacking up, it's time to have a conversation with your healthcare provider. A simple exam and test can reveal a lot, and getting ahead of the problem could save your life. Remember, early detection is everything. We've just walked through 13 early warning signs of heart failure, some obvious, some surprisingly subtle. Now, let's step back and look at the big picture. The most important thing to understand is this. Heart failure doesn't usually happen overnight. It develops gradually, often over months or even years. And while that may sound frightening, it also means you have opportunities to catch it early, if you know what to look for. That's why paying attention to these small, everyday changes matters so much. Something as ordinary as climbing the stairs, waking up at night, or noticing your socks leave deeper marks than usual, these aren't always just normal signs of aging. Sometimes, they're your body waving a red flag. And let me emphasize this again. Noticing 2, 3, or more of these symptoms together is where it really becomes concerning. A single symptom might have many explanations, but when they start overlapping, like fatigue plus swelling plus shortness of breath, that's when it's time to get checked out. You might be wondering, if these signs are so common, why don't more people catch them earlier? There are a few reasons. Gradual onset. The symptoms creep in slowly. You adapt without realizing it. First, you walk slower. Then you avoid stairs. Then you start needing extra pillows. Each step feels small, but they add up. Misattribution. People often blame stress, poor sleep, or just getting older. While those can be factors, they shouldn't automatically explain away major changes in your stamina or breathing. Embarrassment or denial. Let's be honest. Many of us hesitate to bring up symptoms with our doctor because we don't want to sound alarmist, or we're worried about what they might find. But catching it early can mean the difference between simple lifestyle adjustments and a medical emergency. Medical research is very clear on this point. Early intervention saves lives. Studies show that people who recognize and act on early symptoms of heart failure have a much higher quality of life and often avoid repeated hospital visits. Catching the condition early means treatment can start before the heart muscle is severely weakened. That gives medications and lifestyle changes a much better chance of working. In some cases, early treatment can actually reverse some of the damage or at least slow the progression dramatically. Think of it this way. Ignoring these signs is like ignoring the check engine light on your car. The longer you put it off, the more expensive and damaging it becomes. Now, the term heart failure can sound terrifying, but here's the encouraging part. Modern medicine has come a long way. Doctors today have an incredible toolkit, including medications that help strengthen the heart, regulate fluid, and control rhythm. Lifestyle changes, like improving diet, quitting smoking, managing stress, and increasing gentle physical activity that can significantly improve outcomes. Devices and procedures, such as pacemakers, defibrillators, or minimally invasive surgeries that can support heart function when necessary. In other words, heart failure is no longer the hopeless diagnosis it once was. With early detection, it's often a manageable condition, and people can live long, fulfilling lives with the right treatment plan. One of the best things you can do for your health is to become an active observer of your body. Start paying attention to changes like how often you feel breathless, whether your sleep position is changing, if your rings, socks, or shoes feel tighter than usual, how your weight shifts from day to day, whether you feel more tired than you used to after the same activities. These are subtle patterns, but together they paint a very clear picture. Keeping a simple journal or even using your phone's Notes app to track symptoms can be incredibly helpful, not just for yourself, but also for your doctor. Now, I don't want this video to leave you feeling anxious or overwhelmed. The goal here is empowerment, not fear. Think of it like this. Your body is constantly sending signals. By learning to recognize them, you're taking control of your health in a way that many people never do. And remember, noticing a few of these symptoms doesn't automatically mean you have heart failure. But it does mean it's worth checking in with a healthcare professional. At worst, you'll have peace of mind. At best, you'll catch something early and dramatically improve your long-term health. So here's what I encourage you to do right now. Reflect. Think about the 13 signs we discussed. Do any of them sound familiar? Have you brushed off symptoms that might deserve more attention? Track. If you've noticed anything unusual, start writing it down. Record your weight daily, note when symptoms occur, and see if there are patterns. Talk. If you're concerned, schedule an appointment with your doctor. Bring your notes. Doctors love when patients can describe symptoms clearly. It makes diagnosis much more effective. Let's quickly recap the 13 signs one more time. Shortness of breath with simple activity, needing extra pillows to sleep. Waking up gasping for air. Fatigue and reduced stamina. Swelling in the lower body. Rapid weight gain from fluid. Frequent nighttime urination. Nighttime cough or wheezing. Palpitations or irregular pulse. Dizziness or fainting episodes. Abdominal bloating or early fullness. Shortness of breath when bending forward, cold hands, feet, or narrow pulse pressure. If you remember nothing else from this video, remember this. Don't ignore changes in your body, especially when multiple signs appear together. If you found this video helpful, I'd love for you to let me know in the comments by typing the word helpful. It's a small thing that really motivates us to keep creating more life-saving content like this. Also, please like, share, and subscribe. Sharing this video might literally save someone's life, because you never know who in your circle is silently dealing with these symptoms and brushing them off. Subscribing also means you won't miss future videos where we dive into practical, research-backed health tips that you can use right away. And if you've personally experienced any of the symptoms we talked about today, share your story in the comments. You'd be surprised how many people are going through the same thing, and your words might encourage someone else to take action.